As Matt mentioned, I'm Russell Judd. I'm the Chief Executive Officer of Kern Medical. Let me first express our appreciation to Matt and to county leadership and to the Board of Supervisors for engaging the hospitals in this very important discussion to ensure that we have the needed available space, hospital beds, to meet the needs of our community. As a hospital, there's a lot that goes into caring for a patient. You need space, you need equipment, you need medications, you need supplies, and most importantly, you need people. Healthcare is a service industry. It is people who care for people in a desperate time of need. And so as we have been preparing for the many months for this increase in this COVID crisis, each hospital has prepared surge plans. We were asked very early back in March by the state of California to put together plans to grow for 20% and then to increase an additional 40% of our licensed capacity to provide care for a surge of patients. We put most of those plans in place. And as we all know, the surge didn't happen then. What we thought would be in March or April is now upon us in July and August. And so with the increased number of disease in our community has led to a significant increase in the number of patients who are hospitalized. That number continues to grow. All the hospitals are at the point of max capacity, and we're now beginning to implement these surge plans to be able to care for the people in our community. This agreement that Matt referenced is a commitment that the county has come forth to allow us to staff above our ICU capacity. Each hospital is committed to ensure that there's enough, mainly nurses and all the other that goes with it, to staff up to their licensed ICU beds. This is now to take us over that licensed capacity into this surge. Of course, these plans have to be communicated to and approved by the California Association of Public Hospitals. We notify them when we go above our licensed area. There's many regulations that we're aware of and that we follow and that we communicate with the state with. But this contract with this registry allows us to recruit and bring into the community these additional, particularly we're focusing now on ICU nurses. They don't live in our community. There's not enough RNs who live in Kern County to provide this level of care, and so you contract with this staffing agency. They're actually a broker, and they will go out and sign subcontracts with dozens, if not even hundreds, of other nursing staffing agencies to provide the staff. They will come from all over the country. Their wage is extremely high, sometimes in excess of triple what you normally pay for a nurse. However, we're securing this now in anticipation of the continued increase in the number of cases. We are firm believers that if we waited until the crisis hit and we got to the point where we had to have them now, there would not be any nurses available. We will be drawing upon the pool of nurses that people from other parts of California will draw from, people from Texas, from Arizona, from all over the country. There's a limited supply, and we want to ensure that we're securing the needed staff in anticipation of this growth. So it's great foresight on the county in partnership with the hospitals as we plan for the future to ensure we're not just able to meet what the demand is today, but what the demand may be in October, in November, as we see this increase. If we don't see the increase, if a vaccine is developed and or the disease runs its course, then yes, resources could have been spent that may not needed to, but the alternative is a much greater risk. Much rather to have the staff available than to put ourselves in a situation where individuals need care and it cannot be provided. I should mention, right now we're focused on the ICU. As Matt mentioned, with the hospitals identified, we are looking to expand that to the other hospitals in the community, some of the smaller and more rural hospitals. We will be now, next phase is identifying how we provide additional staffing for them so that they're able to also handle the increase of patients that we know will be forthcoming. So again, I want to express my appreciation on behalf of all the hospitals for the county using these funds. It's a great use of these funds. It is very expensive. The hospitals, yes, they receive a reimbursement for caring for the patients, but the cost of these nurses is well beyond what the reimbursement will come from insurance companies and the federal government. These funds that are coming from the county are being used for the public good. They'll be used to treat people who have no insurance or are underinsured and where the costs are not covered by insurance. So we are working to be prepared. We recognize our very important role of ensuring that when people need hospitalized care for this disease, that resources and space is available to meet that need. Thank you.